On this vote, the ayes are 219, the nays are 212. The motion to concur in the Senate amendment is adopted.
Freedom dies a little bit today. Unfortunately, some are celebrating.
Why are you against this bill?
The president, when he was inaugurated, said he wanted to do things to increase access, decrease costs, and increase quality in health care. Unfortunately, over the last year, the bills that were written and the one that was passed effectively not only doesn't do those things, it will make things worse.
Well, how do you respond to one of your fellow doctors who says this bill is horrible and there's nothing redeeming about it?
Imagine if we had a humane system of healthcare delivery in this country. Everybody was covered. Everybody got primary and preventive care and urgent care. And we were thinking about switching to what we now have, where if you change jobs, you lose your coverage. And if you happen to have a chronic disease and need insurance most, you can never get insured again.
How will it make things worse for an average patient like myself or anybody watching this?
On a monthly basis, you'll have the IRS peeking in to make sure that you have adequate health insurance. And if you don't have adequate insurance, they'll be in a position where they can just take your tax refunds. That's a huge difference from what we have now and what we've ever seen in this country.
What would you tell our average viewer are the top 3 best things in this bill for them?
For our society as a whole, the benefits are that many people who are left out of the system will now be covered. They'll have access to urgent care, access to primary care, access to preventive care. We're currently taxed, really, to pay for the care of the uninsured, and they get late-stage care. So I think we'll all benefit in that all of the dollars we spend on health care will be better spent.
We also have to look at this basic idea that if you give people insurance, that they'll stop going to the emergency room. In the state of Massachusetts, what they've shown is that emergency room visits are significantly up over where they were before. And if you look at who goes to the emergency room, the greater the level of subsidy for the health insurance, the more people go to the emergency room.
Most Americans have health insurance. I have health insurance. You have health insurance. Is there any danger that I will see a degradation in my care as a result of this?
I feel quite confident that my insurance coverage and yours will stay the same, but even we are vulnerable. If we were to get sick, and I trust you're healthy, as am I, but we could get diabetes or have heart disease, and our job could change. And we might suddenly find ourselves out in the cold. I mean, that's the stunning thing about the current system in the United States. Everybody really is just one job change away and one chronic disease away from being out in the cold.
At the end of the day, healthcare decisions are best made by patients and families. And this bill, through its 118 new bureaucracies, will effectively create an environment where patients and families have less control over their healthcare decision making and not more. And that, as someone who takes care of patients, isn't good.